This is the video on the peripheral nerves. Peripheral nerves are made of collections of axons from the neurons. They can be sensory, motor, or both. Each axon is ensheathed, supported and held together by a tissue known as endoneurium. This is a delicate tissue with fibers that run longitudinally oriented to the fibers. The axons are bundled together into fibers called fasciculi. Each fasciculus is surrounded in tissue called perineurium. Perineurium is made up of connective tissue. Bundles of fasciculi form the nerve itself. This is covered in epineurium, a tough connective tissue that protects the nerve. In real life, it looks like this, with the axon, endoneurium, fascicle, perineurium, and epineurium. The spinal nerves enter and leave the spinal cord at a specific level. The C1 nerve enters or exits the spine between the skull and the first cervical vertebra. C2 exits or enters from the junction between the first and second cervical vertebra. This continues until C8 leaves between the cervical vertebra 7 and the first thoracic vertebra. From there, each nerve leaves the spine from the junction below the same numbered vertebra. For example, T8 leaves under the 8th thoracic vertebra. This continues down through the rest of the spine. So, even though there are 7 cervical vertebrae, there are 8 cervical nerves. There are 12 thoracic nerves and 5 lumbar nerves. As these enter the spine at a precise level, only one can tract the dermatome for that level. The sensory area for the nerve that enters at T8, for example, covers a strip of skin encircling the lower rib cage. Knowing the dermatomes can help in a clinical situation of examining a patient with a spinal cord injury to determine the level of the injury. Sensory information comes in through the dorsal root ganglion into the dorsal horn of the spinal cord. Motor nerves leave the spine through the anterior or ventral horn of the spinal cord. These nerves go on to innervate the muscles. Each nerve leaving the spine at a certain level will innervate certain muscles. Knowing which spinal nerve innervates which muscle will help in the clinical setting of nerve injury or herniated discs. Nerves exiting the spinal cord can combine once outside of the spine. There are 2 large nerve combinations, the brachial plexus and the lumbar plexus. The brachial plexus is an interconnection of the cervical nerves with the main contributors being C5, C6, C7, C8, and T1. They form 3 trunks, break apart, and recombine to form 3 divisions, which break apart and recombine to form 3 cords. These then break apart and recombine to form 8 nerves: radial, ulnar, median, musculocutaneous, medial cutaneous of forearm, medial cutaneous of arm, and thoracodorsal nerves. There are nerves that also branch from the trunks and the cords. A herniated disc occurs when the soft inner tissue of intervertebral disc extrudes outward and compresses the nerve as it tries to exit the spine. This puts pressure on the nerve and presents with symptoms of numbness along a certain dermatome and/or weakness in the muscles supplied by the nerve. This is often fixed by surgery. This ends the video on the peripheral nerves.